Hello and welcome to the Quincy Access Television studios. I'm Mark Crosby. Thank you for joining me and my guest for Your Health. My guest is Katelyn Kirby. She is a public health nurse in the city of Quincy. Welcome back as always, Katelyn.
Yes, thank you so much for having me.
Pleasure to have you, and I know we've said this before, but this program not only plays in Quincy, it actually plays nationwide.
Yes, which is incredible. And I'd like to say that I always use information that is very generalized. So like resources would be like the arthritis.org and the American Arthritis Foundation. So I do try to go generalized so it does work and is applicable to other states, of course. But when in doubt, always check in with your local board of health, I'd like to say. Very
good. And you did tease the topic, arthritis. Today we will be talking about arthritis awareness.
Yeah, so it's a very large topic, of course, but I just think it's very important to be aware that it is very common. A lot of people do have arthritis. So I just thought it was very important to go over some of the most common types that we see and when to reach out.
Very good. So we will start with an overview. We will start with definitions, talk about types of arthritis. That would be osteoarthritis, rheumatoid arthritis, and gout. We will then look at commonly asked questions and then a place for folks to find out more.
Yes, yes.
So definition.
So when we are talking about arthritis, it is not a single disease. It's kind of an umbrella for a term that refers to joint pain and joint disease. There are more than 100 different types of arthritis.
That's a lot.
Yeah, so it's especially to cover in a quick half-hour episode, it's not easy. That's why we were going to focus on the most common that we see. But the word arthritis literally means joint inflammation. And the joints are places where the two bones meet. So those are your elbows, your knees, your hips, your shoulders. And there are many different types, and depending on the type you have, it can the treatment and the care may be different. So it's important to always follow up with your own healthcare provider to see what works best for you.
As you had mentioned, over 100 types, but we are going to kind of narrow that down.
Yeah, so just in the interest of time, the ones that we'll be focusing on today is our osteoarthritis, our rheumatoid arthritis, and gout. All of these conditions are arthritis, so they are joint pain, swelling, and stiffness, affecting the cartilage, immune system of individuals, and again, it's very tailored management. So even if you have the same arthritis as somebody else, your management might be a little bit different. So always work with your doctor to see your best plan.
So we'll start with osteoarthritis.
Yeah, so osteoarthritis, there is actually a good photo on this screen that shows this. This is our most common type of arthritis. It's referred to as our wear and tear arthritis because it is caused by the breakdown of cartilage, and cartilage is a layer that like protects that bone. So if you think of like a hard bone, this layer is going over it to soften it. So there's a wear and tear over time where the tissue breaks down, that cartilage is breaking down. Risk factors that we see is repetitive movements. So you think of that, especially in like work careers. For example, nursing, if you were a typical hospital nurse and you're squatting every day, transferring patients, that's a lot of repetitive movements to your hip joints and your knee joints.
So I was thinking of sports players.
Yeah, so same thing. Those repetitive movements. Also, we see this with an increase of age because as we get older, obviously there's more wear and tear because your body has been around longer to experience it. And also something that can contribute is if an individual has excess weight. Because that, if you think of it, it's your knees and your hips because it's everything holding your upper body up. So it's very common to have.
And as we look at signs and symptoms, you had mentioned weight bearing. That's
Yes.
an issue, or certainly that's a cause.
Yes, that can be a cause. So what we have for the osteoarthritis, like symptoms people might see, so they might have localized joint pain that worsens with activity and is relieved by rest. Those weight-bearing joints may lock or give way. So sometimes if you're like standing, you might feel like your knee kind of gives out when you like can lose your balance. And that's due to an internal displacement, which can result from the advanced disease if it was advanced osteoarthritis, so it can lead to deformities in those joints. These individuals may have stiffness in the morning or following inactivity, but typically that will, like after 30 minutes, it should loosen up and they should be on their way depending on how severe. And these patients typically have pain which is worse at the end of the day compared to the beginning, because those symptoms, again, they've been walking all day and using those joints. Some of the physical findings a doctor may see are bony enlargements or decreased range of motion. So range of motion, your doctor will look at that for each joint to make sure it can move in the proper ways it's supposed to move. They'll also look for tenderness on palpation of the joint and pain on passive motion. And then also for knees and hips, these are very common sites because, again, those weight-bearing joints. We also can see hand involvement. The base of the thumb can be very common. So it's
all the kids that use thumbs to type on their phones years down the road could have problems.
Yes, and a lot of times you don't know till later. Luckily I feel like nowadays so much of this information is very widespread with the internet. But it's important to know, and some of these conditions might not be specific to osteoarthritis. They could be related to another kind of arthritis. So that's why I always say follow up with your doctor to determine your risk factors and all of that. And then our treatments for osteoarthritis would be, there's pharmacological therapies, non-pharmacological therapies, and surgical management. So again, it all depends on the severity. But there are certain things like physical activity and making sure you're moving those joints and staying active. I always just say go under the advice of a professional, especially if you're just starting out. If you got a new diagnosis of arthritis, you haven't worked out in 15 years, consult with a professional before you just go, because you could injure yourself worse.
And most of the time, a physician would suggest that you start slowly.
Yes, yes. And I would like to say on this slide, just where I'm saying like the medication, those are certain things like Tylenol and ibuprofen. And later on in the slides, when I get to the commonly asked questions, I go a little bit over those medications.
And that's because of the anti-inflammatory component.
Yes, yeah. So it'll bring down that inflammation, help you be able to move a little better. But I feel like I've repeated this phrase, but it is very individualized, especially when it comes to medication, because your doctor has to see what else you're on, what other health conditions you may have. So it's hard for me to just come and talk about all the different types of medication when the individual at home should be consulted with their team on what's right for them.
Okay, next, rheumatoid arthritis.
Yeah, so this rheumatoid arthritis is also a common one that we see. So this is, instead of wear or tear, this is when it's your immune system. It's an autoimmune condition. So rheumatoid arthritis is a chronic condition caused by inflammation to the joints that leads to that pain and swelling. It is caused when the person's immune system attacks its own tissue, like its own cells, by mistake, basically. So rheumatoid arthritis affects the lining of the joints and eats away at the bone underneath them. This causes painful swelling and can cause deformity over time. And a lot of times, so when you think of that wear or tear, this type of arthritis is an autoimmune disease where it's your own body attacking. So this is a whole different treatment. This could be treatments to reduce your immune system so your body's not attacking itself.
But reducing your immune system might make you more susceptible to other influences.
It can. So it does require a lot of management and coordination with care teams. Because yes, if you are reducing, but rheumatoid arthritis, your body is already attacking itself. So you already have an autoimmune disease, so you're already more susceptible to other things in the community. So that's why it's so important to know what kind you are dealing with. Because when these signs and symptoms for the rheumatoid arthritis, they're very similar to the osteoarthritis. So it
would be very difficult for one to play doctor.
Yes, and it's very hard to not play doctor when things are online.
True.
But again, consult with a healthcare professional because there's a method behind it where they're ruling out other disorders to figure out what you may be dealing with. But individuals with rheumatoid arthritis, some signs could be painful swelling that can cause joints to bend out of shape over time. The individual may also have tiredness, fever, or reduced appetite, and that could be because they're in an autoimmune, like their immune system is focused on fighting itself, not fighting off other bacteria. Symptoms we may see, so that painful warm and swollen joints, joint stiffness that most often is worse in the mornings, and after periods of rest, it can last up to 45 minutes or longer. As the disease gets worse, symptoms can spread to more joints, so your wrists, elbows, hips, knees, ankles. And again, where this is an autoimmune disease, it can even spread to affect more areas of your body, including your skin, lungs, heart, nerve tissue, and blood. So yes, it's common, but follow up with your doctor because it should be managed.
And most of the time, symptoms affect some joints rather same joints on both sides of the body.
Yes, so that was very fascinating. Yeah, so like if my right wrist, I would probably have it in my left wrist as well. So it can be bilateral. And I feel like I should have mentioned this, but these things, they're very common. So it may seem like, oh, just get over that. There are different management things. And if you think of it, these affect people's daily living. So even as far as brushing your teeth every morning or getting your medication out of a pill box. My grandmother had rheumatoid arthritis and her hands over time deformed. So luckily I believe she had no pain in her hands, so she was able to continue what she was doing. She was a big cook, sewing, she did it all, of course. But that's why this is so important to manage it, because it affects and it can be very debilitating for people. So rheumatoid arthritis treatment.
Right.
Your provider will consider your age, health, medical history, and how bad your symptoms are. For medications, we may see like NSAIDs, so those are your non-steroidal anti-inflammatory drugs. So that's like your ibuprofen. We also see corticosteroids, so sometimes you'll hear people getting injections into their knees.
And that's what that would be.
Yes, and then in certain cases, surgery may be recommended if it is really affecting their daily living.
And now we will look at gout.
Yeah, so gout is another really big one that we see. So gout is very painful. We typically see this in the joint of like your big toe on both feet. So this is an inflammatory arthritis caused by high levels of uric acid in the blood, leading to needle-shaped crystals forming in that joint.
Sounds painful.
Very painful. It often occurs suddenly in like an intense attack of swelling, warmth, and redness. Most commonly that big toe. And it is manageable with medication and lifestyle changes. And that can be very debilitating because that's a weight you're bearing, all your weight on your foot. So if you are having that gout, you want to make sure you're managing it. Signs and symptoms that we see. So again, it would be an intense joint pain. It would be lingering discomfort. So a lot of times, like, it will be very severe for the first 4 to 12 hours, and then it might linger. So I always say, consult with your doctor. And then there's also inflammation and redness, and then reduced range of motion.
Well, does it, it usually affects the big toe, as you had mentioned, but it can also affect other joints?
So mostly in our, I don't want to concretely say that, but I believe that's the most common one, is that big toe, is where we mostly see it. I'd have to do a little bit more research to concretely say that.
I've always heard it associated with the feet myself.
Yes. Typically, I think back when we had our kings and everything, it was like the rich man's disease.
Right.
Because
Diet.
Because of their diet back in the day, they were rich and wealthy, so they could afford the wine. And because you do see that if you have a lot of alcohol consumption, that could something to lead to high uric acid buildup.
What about red meat?
So that could also be along the lines too.
Okay.
So again, that's why it's so important to figure out what type you have and what could help you, because some of those treatments, there are medications to help reduce that uric acid, which would help reduce the gout. So I always advocate follow up with your doctor to determine.
Let's look at commonly asked questions.
Yeah, so just where there's over 100, it was hard to hit every single one.
I'm amazed that there's over 100 types.
Yes.
That amazes me.
Yes. So commonly asked questions we see, so are women more likely to get arthritis than men? Yes, actually. They are more likely, and there's a higher prevalence in osteoarthritis and rheumatoid arthritis. Women typically report higher pain severity, and after age 50 experience sharper increase in knee and hand osteoarthritis. And there are several factors as to why. One main factor is women's hormones, especially after menopause. That estrogen protected our cartilage and reduced the inflammation, but levels plummet after menopause, which can lead to a surge in arthritis. Also our joint anatomy. So you think our hips during childbirth, your joints shift around to accommodate that child. And that also goes into the elasticity of the tendons, because during childbirth, our joints loosen and become flexible to accommodate. And we also see with obesity, the prevalence in women can tend to be more. And then autoimmune factors, women are 3 times more likely to develop rheumatoid arthritis, likely due to those hormones. So it's very fascinating, and it's even the science behind it. Why are we seeing this? And there can be a lot of contributing factors.
So I'm also thinking of weight bearing, and not only having the child, but then holding the child as the child grows and becomes
Yes.
bigger. Right?
Yes.
There's weight. A lot of that weight is then unfortunately pushed down to the hips.
Yes. I will say, as my daughter's almost 2 now, but mom strength is the thing, because you're just building that weight day after day. You're just learning to carry more weight as the years go on. So it's very fascinating.
Is it hereditary?
So yes, there is a hereditary component to arthritis, meaning if there is a family history, it can increase your risk.
And that's for these 3 types that we're talking about?
It's kind of a blanket statement in relation to all arthritis. But it is interesting that it's rarely caused by like a single gene. There is a genetic predisposition, but it's also combined with those environmental factors, such as age, joint injuries, obesity, to trigger the disease. And that makes a lot of sense because the people who gave you, typically, if you are home living, like if you grow up in the same home, you're growing up with the same foods, the same, if your family likes to go for walks on every day, you're going to go for walks every day and it will reduce your risk. But if your family doesn't do those sort of things, is more likely to just sit on the couch, and which nothing wrong, all in moderation.
Drink wine and eat
Yes.
red meat.
Yes, me and my family definitely sit on the couch and watch Encanto. But it's fascinating to see why it's not just the genetics, but you're likely to share those environmental factors with your family.
What is the BEST? B-E-S-T. Does that stand for something, or is that just?
No, actually.
It's just emphasized.
It's
So
just
what's the best
emphasized.
treatment for arthritis?
Yeah, so the best treatment focuses on managing your symptoms, reducing that inflammation, improving mobility, usually combined with lifestyle changes, medication, and physical therapy. So it's a very collaborative approach. Common approaches, those NSAIDs, so our ibuprofen and naproxen. There's also Tylenol for pain, alongside exercise to build the strength, and in severe cases, joint replacements might be needed. But there are a lot of different exercises you could do, like swimming can be something really good, because when you're in the water, that buoyancy helps relieve the pressure off your joints. I saw a video of a senior dog. He was 18 years old, and his owner brought him to the lake every day to float, to relieve the pain, because
Right.
you're floating in the buoyancy. There are other things like bicycle riding that could be easier on your joints than running. But again, if you're starting new, work with the team to figure out what works.
And I like the fact that you had mentioned running, because folks should be aware of the running shoes, the running sneakers that they're wearing. Make sure that they are, I guess, made well.
Yes, yes. And I will say, I feel like shoes have changed. So even since I was little, shoes are vastly different to help accommodate every type of foot, even like wide feet and all of that.
Right, and there's a reason why there are running shoes as opposed to walking shoes.
Yes, because they provide that good support in the cushioning. And there's a lot that goes behind it. So I do agree. Make sure you invest in a good pair of running sneakers.
Acupuncture.
Acupuncture can be one as well. And that is, I advise everybody at home to kind of look into acupuncture, because it goes into a lot that it can heal, even your mental health and overall well-being. And I did want to mention, like, what if you're unable to take those NSAIDs, such as that ibuprofen and naproxen, due to kidney issues, stomach issues, heart conditions. Something like a Tylenol could be that safe alternative. That is not an NSAID, it's acetaminophen. But again, check in with your doctor, because your doctor may look at your history and say they don't want you to take that. In anything you're taking a lot, even if it's over the counter, like if you're taking Tylenol once every couple months, not a huge deal, but if you're taking that every day, tell your doctor, because they should be aware of that.
Because you can overdo even that.
Yes, yes. There are other methods to helping, like cold and hot therapies. And there's also different like lidocaine patches, like icy hot gels. So there's a lot on the market. There's also a lot to help accommodate. Like, so if you do have arthritis in your hands, there are scissors you can get that you can operate and open with one hand. So do your research, take care of yourself, and make sure, because it can be debilitating. You may say, oh, it's just arthritis, everybody deals with this. Yes, and I get it to a certain point. It could be how far your condition has come. But there's lifestyle changes and things you can do to hopefully make your life easier day by day so you're not living in chronic pain.
So that actually brings me to the end, and that's how to prevent it. Or is there a way to prevent it? And you've kind of gone over those.
Yes, so cannot be fully preventable because hereditary.
Correct.
But, and sometimes like your career, you can't, I mean, yes, you can pick your career, but like you're not going to not go into nursing because you might get arthritis down the line. But some factors that you cannot change, your genetics, age, but certain things you can do to delay your onset or to reduce your severity would be maintaining a healthy weight, using proper body mechanics when you are working or you are in the gym. Also learning low impact exercises, so you're walking, you're swimming, bicycle. Avoid joint injuries the best you can, and also quit smoking, because smoking will reduce your ability, it reduces your overall health, reduces your body's ability to fight off anything, really. So yes, it's just very important. Know your family history, know your risks, and as we say in almost episode, we love preventative care because prevent it early to help prolong and make your day-to-day life easier.
I'm glad you mentioned the hereditary nature of this, because often a lot of folks don't know what existed in their line, but you should always keep that line open, keep that line of communication open so that you can tell a provider, yes, I have a family history, or no, I don't have a family history.
Yes, and it's all about just being honest with your, it's really follow up with your doctor's visits, your annual visits, very important, because this is where they look for all this information to look out for you. So you might not know your family history, but your own history, they'll be able to determine your risk from that even.
And in 1 minute, the resources?
Yeah, so a lot of this information today, and to find out more information, you can visit arthritis.org, the Center for Disease Control and Prevention, cdc.gov, Arthritis Basics, and also the American Arthritis Foundation.
Very good. You did it. You got it all put together in a half-hour program.
Wonderful.
So good job.
Thank you. Thank you.
There was a lot of information there, so that was a task. And thank you at home for watching, and please remember to support the local access station in the community in which you reside for programming just like this.